Hi everyone, Hung Pang, physiotherapist here from Propel Physiotherapy. Just having a little bit of a discussion on the rotator cuff muscles and how we can keep them activated despite having a shoulder or rotator cuff injury. Now, the exercises in the videos are simply some examples of rotator cuff exercises. They are not the be-all, end-all, but certainly they are some practical movements that a lot of clients can and will do and use to get better and stronger faster. As a kind reminder, the rotator cuff is comprised of 4 small muscles in the shoulder: the supraspinatus, infraspinatus, teres minor, and subscapularis. In short, they all play a part in rotating the arm bone, your humerus, and ensuring that that ball and socket stays in the center of the glenoid fossa, which is part of your shoulder blade or your scapula. They all need to be working together to make sure that there's no pain, to make sure that you can use your arm well, and to make sure that you can use it for a lot of functional activities as well. What you'll see in a couple of movements is I'm doing a scap push-up, which is I'm on my push-up position. I'm going down to the ground. I'm also pushing my body away from the ground, either off of my knees or in a standard push-up position. But I'm also giving my shoulder blades or my scapula an extra little oomph at the top of the movement, protracting away from the ground a little bit more. That helps to activate the rotator cuff muscles even more. And because we are in a weight-bearing position, the shoulder joint has no choice but to try to keep itself in the center of a glenoid fossa. So that is a really strong rotator cuff movement at that spot there. Other variations to help the rotator cuff are resisted arm lifts. As you can see, I'm lifting a red resistance band using my right arm. I'm trying to bring that band to tension above my head, controlling it on the way up and then also controlling it on the way down. And to really play into the rotational factor of the rotator cuff exercises, what you'll notice is a lot of people like to do external or internal rotation resisted exercises with a TheraBand or a resistance band. The important part is this: it's that we need to make sure we are practicing internal and external rotation at a variety of angles of where your humerus is laying. So it's not just tucked in right next to you. You got to get the elbow away from the ribs and then potentially work your way to 90 degrees or above, depending on what your goals are and what your functional restrictions are at that time. I always say you want to be able to use your shoulder joint at all angles of arm movement, so make sure that you're practicing those arm angles and the rotational forces that you need to have while using your arm in those different angles. Last but not least, we will also see a variation of a row. That's me pulling on the band against a fixed object, and I'm rowing the band so that my focus is on bringing my arm and elbow back while keeping it very close to the body. And then at the last part of that movement, I'm squeezing my shoulder blade so that my middle border of my scapula or my shoulder blade is coming towards the midline of my body or my back. That gives a lot of shoulder blade stabilizers, some good muscle activation, and that in turn helps with how your rotator cuff is performing. Again, lots of different ways to make sure that your shoulder and your rotator cuff muscles are staying active and doing well. These are just some examples that we use with our clients.